Understanding Procedural Coding, a Work Text, 4th edition. This presentation is going to cover chapters 20 and chapters 21. Chapter 20 is going to be on radiology, and chapter 21 is going to be on pathology and laboratory. So we're going to begin with the discussion on radiology. As always, if you could get a hold of your coding, CPT coding manual, and we're going to flip over to the radiology chapter. This is going to be found right after the eye and ocular adnexa in the auditory system. As soon as you finish up with that auditory system, it goes right into the chapter on radiology. If you're using your CPT manual 2014, your radiology guidelines actually begin on page 392, and your first codes begin on page 394. All right. When we're coding in the radiology chapter, you will notice right off it begins with diagnostic radiology. And basically, even overall, over the entire chapter, which is in our, I like to say 7 series codes, but it begins with code 70010. But you would notice that these the coding is arranged by anatomical site. And so that first section under diagnostic radiology, you will observe that it begins with head and neck. If you flip over, you will see chest, spine, pelvis. I'm having technical difficulties here. Spine, pelvis. Keep flipping. Upper extremities, lower extremities, abdomen, gastrointestinal, urinary, gynecological, and obstetrical. So that's your anatomical sites. But also you have certain sections as well, different sections within the chapter. You will notice that it began with the diagnostic radiology, but they also have your diagnostic ultrasound, your radiologic guidance, your mammographies, your bone joint studies, your radiation oncology, and your nuclear medicine. When you're coding in the radiology section, you need to have an understanding of the different views. They talk about views in a lot of the coding here, especially on the diagnostic radiology. For example, I was just looking at 70110. It talked about a minimum of 4 views. So you got to understand views. Also, positioning of patients is going to be important in radiology. And so when they're discussing the views and the position of the patient, they're talking about where that camera or device that they're taking those pictures is positioned and are set up in accordance to how the patient is position. So you have to have a little understanding of that. You covered that back, I think, would be MedTerm, A&P, all those things there. But you need to have some understanding of that. Your book brings out a lot of those different terms in terms of positioning, abduction, adduction, prone, supine, those types of things. And what you're going to find in radiology is a lot of different tests that they are taking, are radiological tests, fluoroscopy, CTs, MRIs, those types of things, X-rays, all are going to fall under your radiology chapter. You also have some nice definitions given for you in chapter 20 about different types of tests like the CT, the fluoroscopy. You can look at those, PET scans. They have some definitions there for you as well. You will also notice under your diagnostic and radiology, there are a couple of places where you'll see them saying with or without contrast. And basically that just means that they have used some type of material to assist them in viewing that image. And there are different ways they can administer that material. So you pay attention to that, because a couple of your codes differentiate based on whether it's with or without contrast. For example, your 70480 and 70481 would be an example of that. So, I'm jumping ahead. So basically, that's all your radiology examinations, CTs. You can find under those, and you'll see them in the different anatomical areas. Using you see some with the you see the views even on the chest, on the spine. And with or without contrast material threading through all of those different anatomical areas. So you can just flip through those. Same thing, same difference, just different anatomical area. All right, and that flows out or finishes up with that gynecological obstetrical section. Okay. From there, after you finish up with the diagnostic radiology, you'll see a little section there on vascular procedures, starting with your code 75600. And basically, when you are coding in this section, you're going to have some knowledge of vascular families. You will also notice in this section there's a lot of notations here, because a lot of the thing with the vascular catheterizations, it has a lot to do in where they are introducing the catheter, where that catheter ends up. All of those things play a part on the movement of that catheter. All of those play a part in the coding in this section, and that's why you're going to have to be aware of or have knowledge of vascular families, and that's not as simple to do. I always thought that was one of the harder areas. And if I'm not mistaken, one of your appendices gives you some assistance in terms of the different vascular families, so you can avail yourself of that. I can't tell you right at the very moment the specific appendix, but there's one on the vascular families. Under the vascular procedures, you're going to see things like contrast injections, road mapping, venography, angiography, all under this area. Aortographies, angiographies, all of those things are there in this section. All right, but just make sure you pay attention to all your notations to help you out in assigning the correct codes from this area. Venographies, sonograms, all those are under the vascular procedure coding section. From that section, if you flip over, I think the last code there would be your 75893, and then it goes into our transcatheter procedures. Your transcatheter procedures starting with code 75894. And basically, when we thinking about transcatheter procedures, these are procedures in which they introduce or deliver different things within that lumen of the catheter. Maybe like introduce a balloon or a stent or some of those types of things, and that's why they're called transcatheter procedures. And basically, you'll see a couple of different types of services falling under this section. You got transcatheter therapy. You got percutaneous placement of IVC filter, endovascular repair. You have transluminal balloon angioplasty, percutaneous placement of a drainage catheter. And so again, you know, they're maneuvering or moving these things within that lumen of the catheter, and that's why they fall under this section of codes. Again, you see some notations there that you need to pay attention to right above your transcatheter codes. Okay. All right, so if you flip on and you get there to 758989, right after that you see a section on other procedures. Okay. Under other procedures, you see some things for fluoroscopy. Under other procedures, you have codes here. It has complex motion studies, center radiography, video radiography is also under here. Radiologic examinations. If you just flip through, you can see some of the things that fall under here. Magnetic resonance is also under here. Now, a note that your book gives you about this section of coding and more specifically or in particular to your fluoroscopic procedures under here, it tells you that codes for other procedures performed at the same time as the fluoroscopy may be billed separately. All right? So that's something you might want to pay attention to as well, because that will make a difference in your coding. After that, you see a section for diagnostic ultrasound. And basically, in this section, is if you're looking in your coding manual, you can see that it's separated by anatomical site. It starts off with the head and neck, chest, abdomen, and retroperitoneum, spinal canal, pelvis, and so forth. So you see those sections there. The pelvis is is divided by obstetrical, non-obstetrical. Then you have genitalia, extremities, ultrasonic guidance, and then other procedures all falling under your diagnostic ultrasound. You also going to need to, when you're coding in this section, your book brings out, as well as your slide tells you that you need to be aware of the technique used and the extent of the study in order to select these codes. All right? And when we talk about extent of the study, it's either complete, limited, or follow-up repeat. Complete meaning the entire body area, limited meaning some part thereof, and then follow-up repeat means we're duplicating or repeating the study or exam. Now, in terms of technique, because we said we needed to, the codes are differentiated by technique as well as extent. When we look at technique, we got a couple of different types here. You got A mode, B scan, M mode, real-time scan. Nice thing to know, if you were coding on a test or some other plate or in some type of exam, you look there in your notes, they define all of those for you under diagnostic ultrasound. So here it says under definitions in your coding manual, A mode implies a one-dimensional ultrasonic measurement procedure. M mode implies a one-dimensional ultrasonic measurement procedure with movement of the trace to record amplitude and velocity of moving echo-producing structures. B scan implies a two-dimensional ultrasonic scanning procedure with a two-dimensional display. Real-time scan implies a two-dimensional ultrasonic scanning procedure with display of both two-dimensional structure and motion with time. So, and these, if you go down into your coding, you will see them using those terms. For example, in 76510, it says an A scan was performed during the same patient encounter. So you can take a look at those definitions to assist you when you are choosing your codes under your diagnostic ultrasound. Also, your book points out or brings to your attention that when you're coding this section as well, you need to make sure that there's both an image and a written report in your documentation, because that's going to affect the reporting of the codes. You got to have both. Okay. Now, so when you flip through all those anatomical areas, you're going to get to a section, radiologic guidance, right? And under here, you're going to see some codes for fluoroscopy or fluoroscopic guidance, CT guidance, MRI guidance, and some other types of guidance as well in this section. They also tell you from your textbook that it will depend on what third-party payers you are coding for, because some of them will not accept the codes from this site, from this coding section. So it does matter. So you may not use these for some insurance companies. Then after that, you will see a section there, a small section on mammographies, for mammography procedures. And you have to pay attention in here because some of them are unilateral procedures and some of them are bilateral. But you know, if it says bilateral, like for example, code 77058 is for MRI of the breast unilateral, and then they have a code for bilateral for the same procedure, 77059. Pay attention to that because you would not code 77058 modifier 50 if we have a code available for a bilateral. So you have to pay attention to that. Also, you have a section here following your mammography for bone joint studies. And so you got different types of bone joint studies that fall up under this section. You got bone age studies, bone length studies, joint surveys, CT studies for your bones, MRI imaging for your bone marrow, those types of things that fall in here. Bone density tests under your bone joint studies subsection. All right, following the bone joint studies, you have radiation oncology. This section is going to be more therapeutic in nature rather than diagnostic. And in this section, you're going to have codes for the actual treatment of cancer, malignant cancer. And if you notice in that in the codes themselves, you will see different little terminology here. One thing, you'll see them dividing up like the therapeutic radiology treatment. You can have simple, intermediate, complex treatment. You also see a section there for planning, but you got definitions for what simple, intermediate, and complex there in your notes. If you pay attention there, it defines it for each one of those. Under radiation oncology, you got consultations. One thing they tell you about consultations in the radiation oncology, that preliminary consultation they do for this type of treatment is not going to be coded in this section. You're going to use an E&M code, medicine code, or surgery codes for consultations. You also see some codes like in your 77280 section for, it says something about simulations. And basically, a simulation is something they do to try to figure out how to set up the treatment area on the body in terms of how big is the tumor, what's the location, where they need to put the ports to begin that treatment. So they'll simulate that disease in order to get all these things set up. So there is a code, there are codes for simulation. You see that starting with the 77280, and they also have levels, simple, intermediate, complex, and the definitions above there in green. You also have a section on medical, radiation, physics, dosimetry, treatment devices, and special services. And you have teletherapy that falls under that, and radiotherapy plans that falls under there. Brachytherapy falls under that section. And I was going to point out here, make sure you may have to like really extensively read your textbook because of some of these terms you may not be familiar with, but you got sections there, like right there under radiation oncology. It goes over some of those terms, like dosimetry I just used there. They define that for you, isodose, those types of things. You may want to go ahead and use that so that you can understand what they are telling you in the code descriptor. Also under radiation oncology, you have stereotactic radiation treatment delivery, neutron beam treatment delivery, and radiation treatment management. One thing you need to know in terms of your radiation treatment management, they talk about, let me see where I can, like 77435 says entire course not to exceed 5 fractions, and it's in 1 or 2 fractions only in 77431. And basically when they're talking about fractions, they're talking about the treatments. And I was trying to find in your book where they had mentioned the, let's see if I can find it here for you. Okay, so it says radiation treatment management is reported in units of 5 treatment sessions. Sessions are not time-driven. They also tell you that multiple treatment sessions on the same day are counted separately, so long as there's a distinct break in therapy sessions, and the fractions being counted would typically be rendered on a separate date. So they normally go in 5 treatment sessions, not time-driven. That's important. And I think in your coding manual, it tells you under radiation treatment management is reported in units of 5 fractions or treatment sessions, regardless of the actual time period. So it says it there as well. Multiple fractions representing 2 or more treatment sessions furnished on the same day may be counted separately as long as there has been a distinct break in the therapy session. It's also written in your text, in your notes. So you need to pay attention to that because, as I was saying, you'll see a lot of these codes like 77427, it's talking about 5 treatments or fractions of sessions and those types of things. So you need to know what they're talking about. And it also tells you the different types, the professional services that are included during the treatment management. So you could read those and know what's included, and it'll give you some guidance on some things you may need to code in addition to that. You got proton beam treatment delivery also under here. Simple, intermediate, complex. Has definitions on what that includes. That's also under radiation oncology. You have a section there with that proton beam. They use that radiation to high beam radiation on the tumor to help shrink the tumor. Hyperthermia uses heat to speed up cell metabolism to get rid of the tumor. It tells you got a variety of sources like microwave, ultrasound, and those types of things to do that with the hyperthermia. You also have clinical brachytherapy, another method for treating malignancies that falls under radiation oncology. The next section is for nuclear medicine. Okay, and basically nuclear medicine uses radiation isotopes, and under this section, under your nuclear medicine section, you have your diagnostic and therapeutic procedures. It begins with diagnostic. If you look at right above the first code, 78012, if you flip over and you go through several anatomical areas, and it wraps up with other procedures, and then you have a therapeutic section for nuclear medicine. So you got different body systems for this section of coding. If you just look through those, you got thyroid imaging, you have limb imaging, different types of imaging in the different sections. You'll also see there, I was just looking at one of them where it talks about uptake. And I was just eyeballing one of the codes, and I had just saw it, and then I lost it. Well, maybe I'll see it in a second. Oh, 78014. It says with single or multiple uptake. And basically your book tells you that uptake looks at the amount of time that a substance takes to draw up or absorb. So that's what they mean by uptake. All right, so they're treating it with radioisotopes, diagnostic, and remember, diagnostic means they are trying to determine something or trying to figure out what the disease process is, whereas your therapeutic is trying to treat it. And so we got those divided in that manner. So under your diagnostic, you got it in anatomical areas of body systems. You see respiratory, nervous system, genitourinary. Then you have other procedures section. You got radio pharmaceutical localization carrying on here. And when they're doing radio pharmaceuticals, they are using drugs basically to assist them in treating for this malignancy. Then under therapeutic, you have codes there. They have oral intravenous administration codes, inclusive of the mode of administration. That's on your therapeutic. So you got radiopharmaceutical therapy there, but again, it's therapeutic. So they're actually treating it versus the radiopharmaceutical therapy that was under other procedures in a diagnostic manner, actually. So I kind of crossed over. But under the therapeutic, there are the radiopharmaceutical therapy there as well for treatment. Okay, now that wraps up our discussion for radiology and the coding that falls under the radiology section. A lot of times when we were in those other sections, if they were using fluoroscopic guidance or something and they told us to code it separately, a lot of times you will find yourself in the 7 series codes. A couple times that occurred, so we just finally went over radiology where all those codes reside. Again, if it's the radiology of that guidance, radiological guidance is included in the descriptors in those other sections, we had no need to pull a code from our radiology section or our 7 series codes. Now from there, as I mentioned at the beginning of this presentation, we're going to have a discussion on Chapter 21, Pathology and Laboratory. And so in your coding manual, you can just flip 1 or 2 more pages, and voila, we're there. Pathology and Laboratory Guidelines. You also see in your coding manual they have multiple pathology tables with codes, and they got a lot of different terminology there, and we're going to learn a little bit about that in just a second. But it begins with a bunch of tables with different types of testing in the laboratory and pathology testing. And when we get through with our conversation, you'll know a little bit more about how to navigate in those different tables. In that section, this is where you're going to see codes reflected from the physicians and stuff ordering tests from their encounter with that patient. Maybe they're trying to figure out what the patient has so they can create a plan, or they're trying to, ensure that a certain diagnosis is what they really have. Those types of things. You're going to often see pathology and laboratory type testing done on an outpatient basis, your book tells you. Now, we're going to start your pathology laboratory code start out with panel tests. Your first code being your 80047. There are 10 of those panel tests, and basically a panel test is a group of testing. Certain times there are tests that tend to always be done together. You will think a lot about those when you have your immunizations for your kids and those kind of things, or maybe you come in pregnant, newly pregnant. There's a set of tests they always do together, and so they end up creating panels, and that panel is one code that represents that whole family or group of tests. When you have a panel test, then you do not code the individual tests separately. That would be a no-no. You also will not code multiple panels if one or two of the tests are overlapping. And what I mean by that, if in one code panel test, I got one type of test, maybe a glucose test, and then in another panel test code, they also have glucose tests included. We can't code those two panels together. You can't double code individual tests. All right. When you're building together, you do not need modifier 51 if you're using a panel test as well. So you see a bunch of those there. You can look at them, and like I say, there are 10 of those panel type tests. 80051 is an example of electrolyte panel. That's what your screen is telling you here. All right, moving on from your panel test, you have a section there on drug testing. Starting with your code 80100. If you flip over there, you see with your drug testing, certain things you need to know about drug testing. You can have what we call a qualitative test. A qualitative test is one in which the test tells you if a certain substance is present. And a lot of times with your qualitative test, they're going to come in twos, where one, they're going to test for that substance, and then the second test they're going to run to confirm the first test. For example, if you look, I think it was in the very beginning, it even mentions to you in your guidelines, but you can also see it in the notations under drug testing. It says 80100 for each multiple drug class chromatographic procedure, and then use 80102 for each procedure necessary for confirmation. All right. Your book tells you that when I said chromatographic method, basically this is where they use a combination of a stationary and mobile phase to test for a substance, and that whole thing included is one test. All right. And it tells you that it separates out two or more drugs or a class of drugs under your chromatographic method. All right, so they use that term, chromatography. All right, so basically they come in twos, one to test for the substance and the second one to confirm. Now, that's a qualitative test. You also can have a quantitative test that's going to measure how much of that particular substance is in your system. These are also called drug assays. They measure as well as identify substance. So if they want to test for a certain substance in your system as well as how much of that, then they will use a drug assay. So in our next section, it talks about therapeutic drug assays, starting with 80150. So we already know what an assay does. So they're going to look at how much of a substance is in a person's blood. And your book tells you any source material may be used for this examination. And if you look in your coding manual, you'll see all types of things they can test for: caffeine, digoxin, lidocaine. So, you know, whatever. But that's a therapeutic drug assay. Now, after that, you have one for evocative suppression testing. And they use these to confirm or rule out a diagnosis. And in this section, it only reflects the technical component of the test. Just the technical component, I guess the actual testing. The professional component will be coded in another different section. All right. It also tells you in this section you can't use prolonged service codes, and we talked about those in E&M. Now, you also may notice, if you look like in 80400, it says cortisol, and it says 82533 times 2. It tells you in your textbook that time 2, that tells you that test was ran twice. And so, therefore, when that happens, you only have to code that one time. You don't need to have 2 codes. That twice run test is already included in that one code. All right. In the next section, if you flip on over, you got consultations. And it says clinical pathology. It starts with 80500. And then you got 80502. And these are our consultation codes for your pathologists. They use these codes. And basically, this is indicating them giving a medical interpretation and not a test. And you got 2 code choices here. One for limited and one for comprehensive. All right, from there, you got urinalysis. That starts with code 81000, and basically these are for tests on urine. And it tells you in your book you do not need to know how the test was run. So you dipstick or tablet, microscope, or automated, any of those urinalysis, tests on urine. Not much more to say there. Following the urinalysis is molecular pathology, starting with your code 81200. There's a lot of notations here on the molecular pathology. If you flip through, you see it even gives you in your coding manual definitions to a lot of the terms that they are using under this section. Basically, these tests are used to analyze nucleic acids to detect variants in genes. And they got a tier 1 and a tier 2. If you flip through under molecular pathology procedures, and they have a lot of little uncommon words. For example, in 81200, ASPA, which stands for aspartyl-acrylase, gene analysis. And so if you didn't know what common variants was, right there in the notations before it, there's your definitions to help you out with some of the terms or the descriptors in or some of that coding language within code descriptors. So you need to pay attention to all those notations. These codes are going to include all your analytical services that are performed. Any procedures that are performed prior to cell lysis should be reported separately. All right, so you need to notate that. All right, it's a large section under molecular pathology. All right, so flip through that, and then it will take you to our next section, which is on multi-analyte assays with algorithmic analysis. Okay, and this coding section starts with 81500. And basically in this section, these are essays, and we talked about what those type of tests are. But what they do is, once they get the results from those essays, they're going to analyze that using some kind of algorithm. All right, and basically they're looking for usually they're using these to determine risk for a particular type of disease. Okay. After that section, you have a section on chemistry, starting with your 82000. These are quantitative tests, and they use different specimens. And specimens could be blood, stool, urine, blood serum. All of these are considered specimens, or for another word for them, are analytes. All right, and it tells you, if you're coding this section, if you don't know what the source is from the documentation, any code can be used for any of the sources. All right, so you can flip through there and look at some of the types of things you see here under that. Allylase, amylase, barbiturates, bile acids, vitamin D, calcium, testing for all that kind of stuff, cortisol. Okay. All right, so after your chemistry section, which is a pretty huge section, it ends with 84999 for an unlisted chemistry procedure. And then after that, it goes to hematology and coagulation. Knowing your A&P and med term, you should know what those are. So we're looking at blood, right? And they're looking at clotting, blood clotting. So they do different tests to determine how well your blood clots, how your blood count, those types of things, all going to fall under your hematology and coagulation section, those type of tests. Bleeding time. Okay, you can flip through and look at that. Clotting factor, clotting inhibitors, prothrombin time. All right, so proteins in the blood, all that kind of stuff. All right, so if you flip on over, and if you get down, you need to get to code 86000, and you have to do a couple of flipping. You'll get there. And this is your immunology type tests, and basically they test sensitivities, allergies under this section, because it's dealing with your immune system. So some of the codes say like allergen specific, all kinds of different things, looking at your allergies and sensitivities. All right, after your immunology, transfusion medicine is next, beginning with 86850. And here, this is transfusions, right? Blood components, looking at antibodies, blood typing, antibody screens. All of those things will fall under your transfusion medicine, blood transfusions type testing things, testing those things for blood transfusions. All right, after your transfusion medicine, you got microbiology, right? They're looking at different organisms, right? Identification of microorganisms, technique for obtaining organisms is what we need to be looking at in this section. Anatomic pathology, starting with HIM2253C. Keep flipping over in your coding manual. Anatomic pathology. This is for your autopsies, postmortems. So they would be using the codes there. Represents physician services only. Use modifier 90 for your outside laboratory in this coding section. Cytopathology. Right. This is, you're going to find your pap smears, cervical screens in this section. All right, and if you're looking in your code, they use that CIN in several of the codes here. Let me see, I was looking at one. But basically, your book as well as the screen tells you that stands for cervical intraepithelial neoplasia, CIN. Okay? 1 designates mild dysplasia, 3 designates severe dysplasia, so it's on a scale. In several of these codes, you'll see them use that CIN1, CIN2, and CIN3. My eye was on it, but I have lost it. But you will see it as you as you're looking through those, reviewing those codes. After that, you have cytogenetic studies, and these are small sections covering some of everything. Your cytogenetic studies looks at heredity and genes, chromosome studies. That starts with your code 88230. You got a couple of notes there that you need to pay attention to. Surgical pathology. For your surgical pathology, this is your gross and microscopic examinations. It starts off with codes like 6 levels, and you got some notations there about those different levels, and you got different types of exams falling under those levels where they're doing exams of a specimen. All right? So you got your 6 levels, and then you got a couple of other codes there falling under surgical pathology. After surgical pathology, you have in vivo procedures. You got bilirubin, hemoglobin that's looking at. You got an unlisted in vivo procedure as well. You got other procedures following that. You got reproductive medicine with embryo preservation, insemination, semen analysis, gastric specimens, sperm identification, storage of different things like semen, embryos that we talked about. All that falling under the reproductive medicine, and you got some other things under your other procedures code, like a caffeine, Halogen test, sputum, obtaining the specimen, sweat collection, all kind of things falling, a couple of different things falling under the other procedures. That is the pathology laboratory in its entirety.